Hey everybody, so today we are going to do a little bit of Q&A with one of our patients. He has just had his teeth cleaned today and we have went over his biofilm assessment and then also his periodontal numbers, which is the measurements that I have taken of his gums. So just to give you a little background, his biofilm assessment was about 50%. So about half his mouth was covered in biofilm, and then I would normally like to see my patients about 20%. The lower the better with this type of assessment. So he has had a little bit of OHI throughout his cleaning, but he's also now had a few more questions just to get into like the nitty gritty of everything. So he's got a few questions about biofilm, so we're going to go ahead and start on that.
First question, what is biofilm and how do I prevent it?
Okay, so biofilm is prevented every day by brushing, but biofilm comes from the foods and the drinks that we eat. Right after you brush your teeth, it starts to accumulate. It's a never-ending process. Biofilm builds up on our teeth from the foods and drinks that we eat, and then it accumulates and grows as we don't brush. So we eat in the morning, and then we go all day. We eat all throughout the day, and let's say we don't brush our teeth before we go to bed, it continues to accumulate. And this eventually will turn into plaque, and plaque is a hardened of the biofilm. It hardens by the minerals in our saliva, and if it's hardened, if it continues to harden and we do not remove it, it starts to build like blocks on top of each other, which makes it really hard to get off. And that's why a lot of our patients come to see us, and they see a tremendous difference once this plaque is removed from their teeth. And then also preventing the biofilm is done every day. We do it ourselves, and we remove the biofilm with our toothbrushes. And then also we remove the biofilm in between our teeth by flossing every day. So what is your next question?
How do I remove biofilm?
So removing biofilm is kind of basically like preventing it, but instead of preventing it, we're removing it. So it builds up over the course of the day, and then we will take our toothbrush and correctly brush our teeth. You want to make sure, I have a little model here, and you want to make sure that you're really getting up under the gum tissue and stimulating and massaging those gums, and then we're rolling down to actually get it off of the portions of the teeth. Biofilm gets everywhere. On the teeth, so above the margin, it gets below our gums, it gets all in these pits and fissures in here, it gets in between our teeth. So every day we have to make sure we're brushing really good and we're flossing as well, because biofilm loves to hide in these little places. So yes, brushing and flossing and a good water pick is a good way to get it out from between our teeth. So now I think we have like one or two more.
How do you suggest I brush, and is flossing really important?
So a good way of brushing. So my patient, just to give you a little bit more background, I diagnosed him with gingivitis, so inflammation of the gums. He had a little bit of bleeding, which is about normal, and he said that sometimes whenever he brushes in the morning or at night, he does bleed. So what I recommend, the brand name, if you want to call it, of this technique that I'm going to teach my patient is called the Stillman's technique, but for him, I would just call it, this is a good way that I would like you to brush your teeth. This is how we're going to do it, and I will also give him some helpful ways of remembering it. So one good way I want to start with is I want to tell him, let's put your toothbrush all the way at the back, point your bristles up, and then massage and stimulate the gums. So we're actually on the gums, And we'll do that 5 or 6 little vibrations, and then we'll roll down to finish brushing the rest of the tooth. And then we'll move, and we'll move down like that. So I really want him to put his toothbrush on top of his gums and on the top of his tooth, and then massage like this, and then roll down. So we'll massage, roll down, massage, roll down. And we'll do that for every tooth in our mouth. It should take you maybe, 20 seconds in each area, side, front, and same on the back. Getting all your teeth clean, front and back. A lot of people forget about these back teeth, the back sides of them, but this is where, on the bottom, this is where our plaque and biofilm really likes to hide at. So then, also after we're done brushing, I normally tell people that I would like them to floss before they brush their teeth so that they're not forgetting to floss. A lot of people have brushed their teeth and then they say, well, I've already brushed, my teeth are clean, I don't need to floss. So I would recommend flossing before you brush your teeth, and then brushing after to follow, and make sure that when we're brushing, we're really getting these back sides of our teeth. Take your toothbrush, point it up to your nose, and pull up. So that's another good method. That's called the Leonard's method. Is just taking it vertical and going up, pulling up. And then we will floss too. And he asks, is flossing truly important? And every hygienist will tell you, yes, it is very important. Like I mentioned earlier, biofilm is just always hiding, always finding a deeper place to hide at, and behind these teeth and in between these teeth are just their favorite places to get. A lot of people forget about them, especially if they have ortho appliances. It's very hard to get back there to them, but they're very effective for the teeth in the long run. So that's why our orthodontists choose those appliances, but they're hard to clean. So a lot of people forget about them. So yes, flossing is very important, and I recommend it to all my patients. And I always tell them that if they are having trouble flossing, or maybe it hurts, I would just say, let's start off 2 or 3 times a week, and then open it every day or so. Don't just floss whenever you have something stuck in between your teeth. So let's talk about some good oral care products that I like to talk about. Obviously, there's a big debate about manual and power toothbrushes. I was a manual toothbrush girl for a long time, and that changed whenever I became a dental hygiene student. I just saw how well that the power toothbrushes worked and how quickly they moved, and I've recently switched over to a good power toothbrush, but a manual toothbrush will work just as well if you use it the correct way. So that's why I always like to show my patients, like I did with him, about how to use your toothbrush. Make sure you put it up there and you really get up under the gums, and then you pull down. Make sure you really, get in every area in the mouth for a few minutes or a few seconds so that you're really getting that area clean and you're not forgetting any place. But these will do a perfect job, and you don't have to spend $60 on a toothbrush to brush your teeth the right way. But power toothbrushes are a good thing to have, and they are a very good investment, especially if you've had a lot of restorative work, or if you have a ortho appliance, or if your teenage kid has just gotten into ortho. They're a good thing to purchase. So another thing is flossing. Our old way of flossing is the string floss, and it does just as well as anything else, just like the manual toothbrush. But sometimes this can be kind of hard for our younger or our older patients because they don't have the good dexterity with their fingers to really wrap it and go through each tooth. So whenever they do have an issue like that, I always recommend a water flosser. It has a little tank back here that you fill with water, and then it shoots out of this tip up here, and all you do is hold it. It does the work for you, just like a manual toothbrush does. So I hope this video has been very informative, and if you have any questions, please just let me know.